if you make a fist like this, can you make a fist? That's the size of your kidney, roughly. One of the most important functions, which obviously everybody knows, is maintaining the fluid balance. So, and when you go to intensive care units, 50 to 75% of the patients in intensive care have some degree of kidney impairment. Roughly 350 to 375 million people in India have some degree of kidney impairment. This is where all the action happens, and this is what you need to protect. So you shouldn't be insulting this filter with your high sugars or high salts or high blood pressure. So the rule of thumb is when you pass urine, it should look clear. Okay, drink to your thirst. As a group, we do in excess of 600 transplants a year. Know your numbers. Probably you should know your weight, your height, BMI. You should know your blood pressure.
What is that one essential thing to sustain life? Water? No, I feel. In today's time, these are water filters, which pumps in and purifies millions in gallons of water for the world population. Similar to that, in our body, an organ that pumps in blood and purifies it so that our health is attuned to the way we want it. And yes, I'm talking about kidney, and we are celebrating World Kidney Day today. And today we have someone who's been in the field of kidney sciences for more than 2 decades now and is leading the medical affairs for one of the biggest hospital chains of India. We have with us Group Chief Medical Director, Dr. P M Uthappa of Narayana Health. We welcome you, sir, to our podcast, Healthcare Off the Clock.
Thank you, Mukul. Thank you for having me. I'm delighted to be here.
So, we'll have this candid conversation around your work, around what are the initiatives that you have been taking. And as I already mentioned that we are also celebrating the World Kidney Day, the field that you started your career with, and then slowly and steadily would be leading in what are the future interventions in the kidney care across the world, and how a normal human can get the best of the kidney care in any part of the world, right? So we'll start first about, little about knowing about your current role right now. So what exactly is the primary responsibility of a chief medical director, and how does it really help in improving the excellence at an institution like NH?
Okay, that's a very open-ended question, Mukul, and probably I'll need 2 days to explain what I do. But I will try to be brief with that particular thing. So I basically look after the medical affairs for the group, as you mentioned in the introductory statement. I make sure there are policies in place, SOPs in place, clinical guidelines in place, and people and the stakeholders follow these guidelines. So I make sure there is a system to monitor, measure, analyze the whole thing. To be honest, I look at my role as somebody who bridges the gap between clinical medicine, operations, innovation, so that all of us are aligned to provide patient-centered care and clinical excellence. You must have heard about 2 specific buzzwords that's been going on in Narayana Health for the last 2 years. They are zero harm and beyond safe. Zero harm is a concept which we're really pursuing across the group. What it basically means is when a patient comes to a hospital, we have to make sure that they don't come to any avoidable harm. Okay? When patients come to the hospital, if you look at the entire patient journey, they might come for a procedure or a diagnosis or a diagnostic or an operation. That forms a very small part of the entire journey. Across the touch points when the patient is in the hospital, we are trying to make sure that they don't come to any harm. Okay, that's what zero harm is. So if something can be avoidable, it should be avoided. Okay, that's a zero harm. The second concept is something a bit more mature. It's a mature concept called beyond safe. So most of the time we are trying to minimize medical errors. So what we are proposing here is beyond safe is a concept where you proactively prevent future harms. So you do proper risk assessment and put in systems in place so that patients don't come to harm. And this is from the learning from everything else we do. So that's beyond safe and zero harm, 2 concepts I was talking to you about, and that has some connection towards the clinical excellence you are talking about. Going back to clinical excellence, which was your primary one of the questions, as I said, it's the highest standard of medical care that can be provided. Okay, so how do we do it? Okay, that's a $1 million question. It's you don't get clinical excellence with one action. Okay, it's a culmination of many action done throughout the group or throughout the hospital. Okay, so how do we do it? We do it through a process called clinical governance. Okay, now what's clinical governance? It's a framework which we have been perfecting for the last couple of years. And what it is if you work within the framework and you tick the T's and cross the T's and dot the I's, and everybody follows it, it assures patient quality and safety. So basically, if you follow what's within the framework, it kind of assures patient quality and patient safety. And we've been doing this for the last couple of years, and we have seen excellent results. What we do is involve all the stakeholders, especially the clinicians, so that there is some kind of accountability and ownership. We are data heavy, and we leverage data and clinical analytics to derive at meaningful insights. We do have matrices coming out of everywhere because we have so much data everywhere. We do audits. Just to give an idea, last financial year we did 2,400 clinical audits. Okay, that's a huge number, and what it basically tells us is shows us any care gaps and helps us to mitigate those problems by understanding or getting some insights from these audits. So that's matrices, audits, data. We follow evidence-based medicine, so we have guidelines and protocols for that. We track lots of clinical performance indicators, what are the KPIs, especially in the clinical systems. And what happens is we have a system of putting them all together and showing it to the stakeholders, mainly our clinicians and nurses at different levels. So at the at the hospital level, at the department level, we can show it to our doctors. At the hospital level, the clinical directors can have a look at it, so they have an oversight of the entire hospital. And at the group level, I see it on a monthly basis for the entire group. So from my level and at every level, there's monitoring, there's measuring, then analyzing, and look at the whole thing and see what's working, what's not working, where we are compliant, where we're not compliant, what else we need to do. So this has been the process, and that has actually helped us to benchmark ourselves against the best. And if there are no benchmarks, we have created our own benchmarks. There's so many systems, so many areas we have created our own benchmark because there are no external benchmarks. So that has really led to the clinical excellence. Hopefully that answers your question. So it's not one action, it's multiple action which culminates into what we want as clinical excellence and patient safety and quality care.
Yeah, I think that was like a lot of insights. For me, and with that, it brings to my next question, because you have practiced nephrology for more than 2 decades, right? So from your learning to taking you back to the initial years of your practice, so there must have been times where you would have explained each and everything to the patients that you're treating, right? Because not all of us are aware about exactly what does one do. So just bringing back to the topic of the hour, so kidney is an organ that it filters down the bloods for you, or impurities in bloods for us, right? So can you further break down the working of a kidney for our audience?
Okay. So if you make a fist like this, can you make a fist? Okay. Yeah. That's the size of your kidney, roughly. Oh. All right. Okay, yeah. So everybody make a fist, and more or less that's the size of your kidney. It's around 10 to 12 centimeters long. It's nice and fleshy and meaty. Okay. And it has a functional part called, as you mentioned, filter. This filter is called nephrons.
Yeah.
Okay. It's a function. There are, guess how many of them are there inside?
Maybe millions?
Yeah, no, there are roughly around 1 million. That's around 10 lakhs. So it varies from, say, 500,000 all the way to 25 lakhs. So it's a huge discrepancy, variation. But generally, we think there are around 10 lakh of filtering units. So in a size, this size, okay? So each filtering unit looks like this. like this, like the cup, like this. So this is called a glomeruli. This is called the tubules and the various parts. And this is only 1 centimeter long, one or 2 centimeters long, all packed into the little kidney. And surrounding it is your arteries and veins and something supporting it. Okay. So all the action happen here. All the action happen, all the filtering action happen here. So you need to be very nice to this part now. So you shouldn't be insulting this filter with your high sugars or high salts or high blood pressure. You know what I'm trying to say here?
Yeah.
So this is where all the actions happen, and this is what you need to protect. So I'll come to the functions of the kidney. So one of the most important functions, which obviously everybody knows, is maintaining the fluid balance. Okay. This is a nice room. It's around 16 degrees here. If I make you drink 2 liters of water, what do you think is going to happen?
I'll have to pee multiple times.
Yeah, next 2 hours you'll be going to the men's room and peeing away. All right, okay. So if I make you run for 5 kilometers and bring you back here, and if you give you 2 liters, what's going to happen?
I think my body will consume that because I've already sweated out a lot.
Exactly. So it kind of gauges how much fluid to keep in, how much fluid to get out. So it's an amazing organ. The monitoring systems within that is amazing. It knows exactly how much to keep, how much to get rid of. So it also depends on the ambient temperature, how much you're breathing, the humidity, how much you're sweating, the geography. But it can calculate all those things. So more you drink, the more comes out, but it'll retain just about enough. So not just water, I'm talking about fluid. So that's a first function. So if you look at that function and see somebody with kidney failure, you might see those people having a bit of swelling.
Yes.
So this particular function has been knocked off now.
Okay.
The kidney can't gauge. You drink water, you get swelling.
Okay.
By gravity, because you're standing. If I make you stand upside down, it'll go to your face.
Yeah.
If you lie down, the fluid will be here.
Okay.
So if more fluid collect, it'll come up your legs, into your tummy, into your lungs, and you feel breathless. So kidney failure patients have breathless or can have swelling because that monitoring mechanism is lost. All right, so it's not able to decide how much fluid to keep in, how much to get rid of. Okay, that's the first function. Hope that was clear. Right. The second function is it maintains the electrolyte level in the body or salt level. So what are the salts you can think of? Can you think of
potassium, sodium, chloride.
Very good. So there you go. So you know your stuff. So you have sodium, you have potassium, you have chloride. So the kidneys decide exactly how much potassium to keep, how much sodium to keep, and how much chloride to keep, and all other things that goes with it. So anything goes above the range, it will get rid of it. Anything goes below the range, it will preserve it. So you got your fluid, you got your electrolytes. The next important thing is it looks after your bone health.
Okay.
All right. Did you know that?
No.
Okay. It maintains a calcium level again at a certain level, just like it does for your sodium and potassium. And any excess calcium it gets rid of it. Any low calcium, it tries to preserve. And that's related to 2 other things. One hormone called vitamin D. Right? You heard of vitamin D. One other hormone called parathyroid hormone. So where do you think you get vitamin D from normally?
Sunlight.
Sunlight, very good. And anything else?
Leafy vegetables.
Yeah, eggs and oily fish and stuff like that. So you have vitamin D. Okay. But the sunlight vitamin D on its own, it's not that effective.
Yeah.
So it falls on your skin. I'm going to get a little technical here, but I'll come to the point. It falls on the skin. It works on a little nice cholesterol there called cholecalciferol. It goes to your liver and it becomes 25 hydroxycholecalciferol. Sorry, technical, but it's very nice. It's still not very active now, this vitamin D. Then it goes to the kidney. The kidney now activates your vitamin D. Calcium metabolism, very important function of the kidney, and it does through so many different things there. So you got your fluid, you got your electrolytes, you got your calcium. You got 2 more to go, I think.
Okay.
Then blood pressure. You must have heard a lot about blood pressure.
Yeah.
Whenever you say kidneys, what's the blood pressure? It's very likely that you'll have high blood pressure later on. But there's a chicken and egg situation here. So high blood pressure without any problem in the long run can give kidney failure.
And kidney failure.
And kidney failure in the long run can give high blood pressure. So somewhere down the line, if you see somebody with kidney failure, if they have high blood pressure, sometimes it becomes difficult to say what came first. So that's your fluid, your electrolytes, calcium, and blood pressure. The next important thing is hemoglobin. Did you know that your hemoglobin is related to kidney function?
No.
Okay. Yeah, you know what hemoglobin is, right?
Yeah.
It's
Is the level of iron in your blood?
Yeah, it's present within red blood cells, and that you need to have a decent level of red blood cells. So you want your hemoglobin between, say, it varies from person to person, say 12 to 15 is the right concentration. So bang in the middle of the kidney, the oxygen concentration is very low. So that's where this particular hormone called erythropoietin is produced, and that has to go into bone marrow and act on the red cells that's produced there and make it mature and help in maturation. Otherwise, they don't reach puberty and they're just dead. They don't do anything. So you need this this hormone which is coming from the functioning kidney. Okay, and if you see people in Leh Ladakh or very high altitude, what do you think their hemoglobin will be?
Lesser.
No, higher.
Higher.
Because the atmospheric oxygen is very low, right? So your
So
body's response is to produce more hemoglobin so that it captures all the oxygen. How does it do that? By producing more erythropoietin. Remember I told you, bang in the middle of the kidney, the oxygen is very low. That's a trigger for that. Okay. Have you heard of Lance Armstrong?
Yes.
The cyclist.
The cyclist.
He won around 7 Tour de France.
Okay.
You know that, okay? And he was caught on doping, which he denied for a long time.
Okay.
And what did he dope on? Erythropoietin injections.
Okay.
And what was the reason? So that was late 90s, early 2000. So erythropoietin had just come in and they had access to it. So they used to inject themselves with this injection. So you can't detect it. Those days you couldn't. And what it does is it increases your hemoglobin levels. If you're 14, it makes it 16 or 17. And it absorbs more oxygen, your performance goes up. So these are elite performers. They just need a little bit of oomph to be better than the rest of the people.
Okay.
So there you go, doping with erythropoietin. All right, Leh Ladakh, high altitude, and the function of the kidney. So for five important things: fluid maintenance, electrolytes,
bone health, calcium. Fourth one is
blood pressure, and hemoglobin. Make sure you don't become anemic.
So that's the answer that I might not have been looking for, but definitely it provided me a lot of in-depth knowledge now around it. So you have rightly put it into a lot of context, and people would now understand more about this kidney health thing. And now coming from there to thing like you spoke about kidney failure, and we call it in medical terms as chronic kidney disease. It's the 10th leading cause of the death worldwide. So what do you think people are overlooking to understand in their daily life whether their kidney is functioning right or not?
Again, it's not that straightforward because the signs and symptoms in kidney failure is very generic. That can be mimicked by so many other conditions like heart and liver, and so many other chronic conditions can mimic the same thing. But just to answer your question, going through the functions of the kidney, one of the things is fluid retention. Next thing is blood pressure. When you have high blood pressure, you might feel a bit dizzy or you get headaches and so many other things with that. You might get itching because of the toxins might get accumulated. The salts might get settled on your skin. You might get the itching. You might feel lethargic. Okay, lethargic because the toxins are accumulating now, or you're very anemic. Remember, I told you one of the functions of kidney is maintain hemoglobin level. So when the toxin level goes up, and anemia kicks in, you feel lethargic, you don't feel like doing anything, your appetite is down, you're losing weight, but still you're having fluid in the legs. So those are a few things you need to look at, but they're very non-specific.
I'll give you a little example from recently. Like on Monday, I met a friend accidentally in one of the clinics. So he was telling me that he recently had the regular checkup just to ensure if everything is fine, and he was perfectly fine. And he had no doubt that he would have any issues. So in one of the tests, it was detected that through his urine, a lot of protein is also leaking. And then he immediately contacted doctor. Why I'm saying this? A normal, healthy human being who doesn't have any issues goes for a health checkup, and then he detects it. So in that scenario, and obviously he spoke to the doctor, doctor obviously diagnosed it. But what are these conditions usually like? Uh, Putting us in those scenario, we won't even understand what exactly is going wrong. So from there, how do we take it?
Urine test is very important when you have kidney problems. Okay, it detects so many problems. Mainly, you as kidney physicians, you're looking for protein in the urine, or you're looking for blood in the urine. The presence of protein suggests that there is a damage within the filtering mechanism. Remember, I told you.
Yeah.
Okay, it's quite significant, and it has to be taken very seriously. Okay, it also means there can be a systemic problem elsewhere. The presence of protein means that barrier is lost, endothelial dysfunction has happened, and endothelial dysfunction, that is the inner lining of the blood vessels, can have a knock-on effect on the entire body. So there's enough evidence to show that if you have proteinuria, you're also prone to develop heart problems and strokes in future. So coming to proteinuria itself, having protein is not good. That has to be thoroughly investigated. Probably you'll have more urine tests, more blood tests, lots of other tests to be done, scans of the kidney. I would also do a kidney biopsy to see exactly what the problem is. So the causes of protein, there's hundreds of causes. I don't think I'm going to explain to you every cause in that. It's taken me 5 years to understand that. But ideally, obviously, it has to be taken seriously, and they should see a nephrologist.
We know about what goes wrong and what are the symptoms now. How we can make it right? Like, what should we do in our daily lives to make the kidney health better?
Yeah, if you're a normal person, there's nothing like you can do which will specifically act on your kidneys, but these are generic advice. One is, as I said, hydration. Okay, it's going to help your body and also help your kidney. Make sure well hydrated. So what do you mean by well hydrated? How much water do you drink? And as I explained to you, it varies from person to person, and what you're doing, what activity and what level of activity you're doing. So the rule of thumb is when you pass urine, it should look clear.
Yeah.
Okay, drink to your thirst. Sometimes it's not clear, a light amber or light straw color is more than enough. So drink to that. So it will be roughly 2 to 3 liters. Not necessarily water, it can be fluid. So that's your hydration. You need to stick to some kind of exercise, okay? Don't sit for too long. If you work behind the desk, make sure you stand up every couple of minutes. We do lots of meetings, and most of the meetings, all of us are standing. If you're living in apartments, go up the stairs, down the stairs, stop taking lifts. Make sure you put in some kind of activity, either walking, running, gym, whatever it is, just put in some kind of activity every day. That's to keep everything moving in your body. So that's your fluid and exercise. And diet, again, generic. There's nothing like one particular food is going to be beneficial to your kidney. What's beneficial to the heart is also beneficial to kidney. So be sensible with your food. Lots of colorful vegetables, lot of colorful fruits. If you're a meat eater, go ahead with your proteins in a prescribed quantity. If you're a vegetarian, go for proteins. Again, you need proteins. Okay. Yeah. So just common sense, making sure you don't take. This is very important. Making sure you don't take over-the-counter painkillers unless it's really indicated, because that can really damage your kidneys. Making sure you don't buy in or fall for miracle cures.
Yeah.
Especially there are a lot of miracle cures running around for kidneys. So there are miracle cures saying will make the dialysis go away or your kidneys function. That's not going to happen. None of those things will happen. So don't go for that. Don't fall for that. I think just common sense.
Okay. Got it. So you have spoken very briefly, but you've just touched upon what exactly, how a kidney failure can happen. So what I have learned from you is that, one part of the kidney can shut and the others can operate. Like one function of the kidneys can shut while others can operate in parallel. When do we exactly say that this is a kidney failure?
Okay. So to answer to your question as to what exactly is kidney failure, you need to step back and look at it differently. There are different types of it. So something that happens over a period of hours, weeks, hours, days and weeks, what we call as acute kidney injury, which is quite common. If you go to any hospital, around 20 to 25% of the patients who come to emergency room have some degree of kidney impairment. All right. So, and when you go to intensive care units, 50 to 75% of the patients in intensive care have some degree of kidney impairment, what we call as acute kidney injury. That requires specialist treatment, preferably by a nephrologist. That patient might require a spell of dialysis, so that it helps the kidney when it's sleeping and recovering. And most of the time they recover, not all the time, most of the time recover. It depends on what caused it, and that should be all right. That's your acute kidney injury. Then the most common one which we all see is something called chronic kidney disease. Okay, that's quite rampant. As you mentioned, you quoted a figure of 10 million and whatnot. So that's what we all are talking about. That's what we all see all the time. So basically, this is a condition where it develops over a period of months and years. Okay, there are situations where patients are in the final stage of kidney failure and the patient don't know it because the body has got used to it. Okay. This is one condition where you can present in the final stages and still be fine. All right. So it's quite difficult in this situation to find out. Unless you have a problem, people normally don't go to seek doctors. So this condition is quite prevalent. There are 5 stages in it: stage 1 to stage 5. Stage 1 being the initial stage 5 being the final stages. And when you have that situation, ideally you should be under a nephrologist, a friendly nephrologist, because remember, all the functions of the kidney I told you, none of them work now. Okay, the kidney is gone, it's affected. You have breathing issues, you have blood pressure issue, calcium issue, electrolyte, your creatinine is high, urea is high, and now your nephrologist is your kidney. He's manipulating your body with medications and treatments to bring everything to normality. So it's very important you be a good nephrologist. And the other advantage of being with a nephrologist earlier on is so he can plan what happens when the kidney fails. So what does he do? So he can treat you for all this condition, but he can also put you on medications to slow down the progression of kidney failure. So if you go to a doctor who's not a nephrologist and go to a nephrologist with the same thing, what he can do is, instead of you having kidneys fail in 1 or 2 years, he can prolong it to 5 years, 10 years. Okay. That's the beauty of it. So it's not going to go away. Once a kidney failure kicks in, it's not going to go away. It'll going to progress. That progression, it can slow down the progression. So you have time to decide what kind of treatment I need towards the end. Do I need dialysis? Do I need transplant? I need to make sure that I have enough money. Do I need to find a donor? There's a lot of things happen towards the end. So that planning can be done properly. So key thing is identifying it, making sure you're under a nephrologist. Very important.
So what I see from a normal person point of view is dialysis and kidney transplant are the only 2 ways for a person who is at the end stage of the kidney disease, right? But almost 2 million people across the globe lack access to it. How do we bridge this gap?
If you look at developed countries, there are registries, okay? And these registries can tell you what percentage of the population have some degree of kidney failure. So if you go to UK and US, roughly 10 to 15% of the population have some degree of kidney failure. We don't have registries in India, but they have some literature. Some people have done some studies. We have anecdotal evidence. So from my understanding, roughly 20 to 27% of the population in India has some degree of kidney impairment, not failure. Okay, of that, only 5% or less will require, or probably less than that will require these extreme treatments. So put that into context. So for sake of understanding, I've done the calculation. So let's say 25% of the population has some degree of kidney impairment. So what's the population of India?
1.5.
1.5 billion, right? That is 1,500 million. So roughly 350 to 375 million people in India have some degree of kidney impairment. What's the population of America? 375 to 400 million. That's taking the entire population of America and putting them in India and saying you have kidney failure. Can you see the scale now?
Yeah, the scale is huge.
And even in that, if you take only less than 5% requiring these extreme treatments, it still comes to around 7.5, sorry, almost 7.5 million in India. So we can't manage.
Yeah.
If all of them start taking medical help, all right, the entire system's medical, all the hospital will go for a meltdown. We can't, we're overwhelmed. Many people die with kidney failure. They don't seek medical help. To answer to your question is, we can't deal with them at the moment. I don't have an answer for that. Probably we should look at it, step back and look at it from a preventive angle.
Yeah.
Okay, preventive angle is sensitizing the general public about, you ask about what should I do? Healthy eating, exercise, hydration, staying away from painkillers, staying away from non-evidence-based medicines, staying away from miracle cures. If you are really at risk, like if you have diabetes, high blood pressure, if you have family history of kidney problems, other medical problems, you're all risk of developing kidney problems. So you have to take some kind of action yourself. You have to seek medical attention before it gets too late. So that's one way of doing it. Sensitizing all the general public through social medias and print media, having awareness campaigns, the other way of doing it. And the World Kidney Day, which is coming up 13th of March. So World Kidney Day happens every year on the second Thursday of March. So it's an opportunity for us, for people like us, to raise awareness of kidney problems for the general public. It's an opportunity to sensitize the stakeholders like the regulatory authorities or the government to increase their scope of services in the hospital, to look at the cost of providing dialysis, because it's very expensive, to look at the medication, cost of consumables. So those are things. So that's the reason we have this World Kidney Days or whatever World Health Day, to just to raise awareness. The regulatory authorities also know what the issue is, the scale of problem, what can they do, how can they pitch in to help us out. So I don't have an answer to how to sort out those people requiring dialysis and transplantation, but this is what we should do, and this is what we've been doing.
I think that's fair enough. I mean, we have a big population, and it's a big challenge. And India is still developing nation, and a lot of people have a lot of resentment towards multiple other things and medication sort of. So during my research, I got to also know that NH has its own kidney transplant program. So how has it evolved over the years?
We have around 20 hospitals, and all our hospitals are equipped with highly trained doctors, niche nurses and technicians to provide kidney care, whether it's dialysis or just follow-up or transplantation. As a group, we do in excess of 600 transplants a year, and we benchmark the outcomes towards the best in the world, and we do extremely well in that. It's growing. We do a lot of transplants which are incompatible. So, in the past we couldn't do that because of let's say blood group incompatibility. So we do a lot of it. So we do quite high-end procedures too. So over the years it has stepped up. Our outcomes are good. The numbers are going up, and the complexity of the cases are also going up. So that's it. So and more and more hospitals within the group are also doing transplant, because in the past it used to be only the hospitals in the metro cities doing it. Now all the tier 2 and tier 3 city hospitals are also doing within our group. So it's going fine.
So what are the challenges that you're facing in your kidney transplant program?
A lot of patients on dialysis, and the best way forward for them to have a decent quality of life and longevity of life is having a kidney transplant. Not all of them are suitable for it, but those who are suitable, they don't have enough donors. Ideally, we want donors within the family or relatives or the first degree relatives. They might not have it, or if they have it, somebody might not be ready to give it, or if they are ready to give it, they're not compatible. There's so many other things that goes with that. The next pool we look at is deceased donor. So somebody in ICU for whatever reason is, have been declared brain dead, and if the family agrees, we can harvest also those organs. You must have heard of that. That's the next thing we look at, and we do register all our patients for this. But again, there's a small pool that comes of it. Though I think one of the statistics says around 3.5 lakh people die in the country due to road traffic accidents on a monthly basis, I guess. It's very unfortunate, but again, if we had sensitized the general population, if they had systems in place across all the states, those patients who had unfortunate deaths could have saved, each one could have saved at least 7 people. Okay, so that requires, the doctors can't do a lot about that part of the system. It has to come from the state, the regulatory authority. They need to have system in place for that. So there are options if you could fine tune that and strengthen that disease donor program. So a lot more people can be saved.
As you know that we are celebrating World Kidney Day, and so if you want to give just one powerful message to our listeners about kidney health, what would it be?
Know your numbers. I think that's been doing the rounds for various other specialties also. So I would also extrapolate that to kidneys. So you need to know, most people know this, probably you should know your weight, your height, BMI. You should know your blood pressure. You should know your kidney functions, that's your creatinine and urea. You should know what's in your urine, but maybe you should also know what's your liver doing and what's your thyroid doing. But if you really want to know what your kidney doing, just do 3 things. I want you to remember CUB, CUB, that is your creatinine, urine, and BP. Creatinine to look at the kidney function, urine, what's in your urine to see what's coming out of your urine, and blood pressure gives you an idea about your general health. So those 3 things.
Okay. So you have been a strong proponent of technology in healthcare. How do you see technology interventions leveling up the healthcare across India?
Do you watch movies, Mukul?
Yes, a lot, sir.
Have you watched the movie Terminator, The Rise of Machines?
Yes, I have.
Yeah, and it's got a nice line to that, isn't it? Rise of Machines. So what's happening is at this moment, rise of machines in medical field, what we call as machine medicine. Okay. And there's been a huge development of technology and machines within the healthcare space. So if you walk into any hospital for that matter, whether you're an outpatient or if you go to, let's say, dialysis center, this is all machines. What's a dialysis machine doing? It's keeping you alive, dialyzing you. So if you go to ICU, you have ventilators, you have monitors, you have syringe drivers, you have BB machines, your point of care machines. We have so many other machines to do lots of jobs. If you go to operating room, you have again ventilators, anesthesia machines, you have robotics. Now you have so many robotics there. Again, you have monitors, syringe drivers, so many things happening there. And if you take more personal, if you look at patients, you have implants, you have defibrillators, you have pacemakers, you have chips in the brain, especially if you have Parkinson's. So many things have come into play in managing healthcare. So I'm not going to dwell into the machines per se or as such, but I would like to take you to in a different journey to look at how technology and software, the hospital information system, is changing the way we deliver healthcare and with the way we do business. So if any big hospital for that matter needs a good hospital information system, and we have partnered with Atma, and they provide a platform on which our radiology information system, our lab information system, our doctor facing apps, nurse facing apps, and patient facing apps are all built on, and that has been a game changer for us. Just to explain it to you a little bit more, the patient-facing app is the most downloaded hospital app in this country at this point in time. From the patient perspective, it makes life easy for them. Yeah. The accessibility increases. Yeah. They can search for doctors, search for hospitals, book appointments or schedule appointments. And when they come to see the doctor and after the consultation, the summary is pushed to that before they leave the room, before they open the door, the consultation summary is there. When they go for diagnostics like imaging, blood tests or any radiological stuff, they can pay for it then and there itself. And the reports and blood tests, everything comes to the same platform. So the patients have access to the hospital, access to the report and everything in one platform. And that's been quite good, and most of the patients like it. The other app which we use, a doctor's app, around 10 lakh conversation happen in that app, in the group. That's a whole lot of conversations. So the doctor, if you're part of the care team, they can access the patients from anywhere in the hospital, anywhere in the city, anywhere in the world for that matter. They can look at what's happening. In some of our units, the ICU monitors are connected to the app, so they can look at the patients in real time, look at the images in real time. They can do referrals, respond to referrals, look at images, look at blood tests, talk to patient relatives, counsel them. They can prescribe medications, they can edit medications, do summaries. Okay, so and that's just a reflection of the desktop main operating system. So it's kind of interchangeable. Our latest addition is NAMA, which is for our nurses, and that has really reduced the paperwork significantly. So nurses can spend more time with the patient rather than fill up forms. And a lot of things have been integrated. All the nurses do, all the monitoring and everything has been integrated to that. So the doctor's app, the nurses app, the patient's app has been quite a game changer for us. It has helped us to drive quality, safety, and operational efficiency, clinical efficiency, and whatnot, and also reduce the number of usage of paper for us. Okay, that's just how we are using technology, and how that's benefiting us.
So from this answer of yours, what the feeling that I've got is, we used to have regular EMRs, just like a data sheet, and now we have ventured into a much more advanced, smarter ones, and healthcare has now become on the go, not only for doctors but for patients as well. They have access to everything within 24/7. Now, moving a step further, I think it's a very detailed description of what you have given. And my sense is that what a lot of hospitals are envisioning right now, that they'll achieve a feat after 20 years, NH is already living it.
You would like to say yes to that, but we are learning. There's still a long way to go. But we have that vision, what to see, how it's going to look in 1 year time, 3 years time, 5 years time, 10 years time.
So being a former practicing nephrologist yourself, how do you keep yourself healthy or your kidney healthy?
I do have my regular health checks. Okay. I just had one recently. Touch it, everything looks fine. I eat reasonably well in the sense, thanks to my wife. I make sure she makes sure that I get colorful vegetables and colorful fruits. I've reduced my intake of meat, but I still eat them. Good meat for that matter. I used to exercise a lot. To the sense, I used to literally kill myself exercising. I used to do endurance runs, I used to do marathons, I used to do triathlons, long distance cycling. I'm a failed Ironman, if you know that. I could not complete the entire race, so I missed it by 3 minutes. But unfortunately, that intensity has gone down for various reasons. You can't cycle in Bangalore, you get knocked off very quickly. So I do still continue with my running, bit of exercising. Whenever I get time, especially over the weekends, a bit of cycling. So the intensity has gone down. Probably it's gone down by 80%, but I still pursue those things which I really like to do.
Thanks a lot, sir. I think that's very enlightening to know to the world that what exactly keeps us healthy, how we can make a lot about our own health, how we can better our kidneys, and and also to that you have simplified a lot of things for our audience to know about their kidney and what to check, what not to. And thanks for your time. You have been gracious enough and patient enough with us to take out time from your busy schedule. And this is how we conclude the episode. Thanks a lot, sir. Thank you so much.
Thank you, Mukul. Thank you for having me here. It was an absolute pleasure to share my views and ideas. Thank you very much.